as well as members of our respective teams on today's webinar, focused on the reopening of licensed childcare centers in New Jersey. My name is Christine Norbert-Beyer, and I'm the Commissioner for the New Jersey Department of Children and Families. As you have likely already heard, licensed childcare centers will be authorized to resume operations and will be open to all New Jersey families under very specific health and safety guidance beginning June 15th. In order to prepare for that and to make sure that our state's childcare providers are supported in reopening safely, New Jersey DCF and the New Jersey Department of Human Services are working together to answer your questions, share information, and spread the word through the provider community about the availability of resources and state assistance. On today's call, we're joined by leadership from the DCF Office of Licensing and the DHS Division of Family Development, who will speak to some of the frequently asked questions we've already received since we released safety guidelines and information about public assistance last week. And we want this to continue to be a productive conversation with our childcare providers. During today's webinar, we're encouraging our providers to ask questions in the comment section on your YouTube page, and we'll follow up with additional communications after reviewing your most frequently asked questions. And if you have any other questions following the end of today's webinar, you can send them to askdcf@dcf.nj.gov, and we'll have the appropriate staff members from either department follow up with you. Last week, when I joined Governor Murphy to announce the reopening of childcare, I said that this is an important step in New Jersey's larger reopening strategy, ensuring a safe, stable, and seamless childcare network for New Jersey's returning workforce, and not just those individuals designated as essential to our economic and social service infrastructure. We appreciate the vital role that your industry plays in helping parents find balance between work and family responsibilities. And beyond that, we know that quality childcare can be a wonderful resource to promote healthy child development, setting children on a path to learn well and grow strong. But in order to take this step to reopen childcare safely and responsibly, as we continue to deal with the global COVID-19 pandemic, we have to be planful and methodical in how we support centers as they reopen. We've developed guidelines informed by the best practices and standards from the CDC and other health organizations that include processes for screening, sanitation, and safe social distancing. Centers will be required to screen children and staff each day prior to entry into the center. Anyone exhibiting symptoms or a fever of 100.4 or higher will be prohibited from entering the center. Class and group sizes will be limited, and groups must be spaced out throughout the center. Staff members will not be able to move between groups. Staff will be required to wear face cloths, cloth face masks, and children over the age of 2 will be encouraged whenever feasible to wear masks. Masks won't be required if they might pose a health impediment, and we will be prohibited entirely during nap time when they may pose an unsafe risk of suffocation. And childcare centers will be required to engage in enhanced cleaning and sanitation practices. Centers will need to let DCF know through our Office of Licensing whether they plan to reopen, and will need to file an attestation indicating that they will follow the safety protocols we've put in place. DCF inspectors will begin visiting and inspecting reopened licensed childcare centers on June 15th in order to support them in keeping children safe. In order to assist programs with meeting some of the additional costs associated with these heightened safety standards, Commissioner Johnson and DHS will be issuing up to $20 million in federal CARES Act grants to help purchase cleaning supplies and PPE for staff. And Commissioner Johnson will speak more to those grants. And finally, the current subsidy program managed by DHS for certified emergency childcare centers will run through the end of June. While we need to be diligent in maintaining safe operations for childcare programs, I expect that the news that childcare will once again be available in New Jersey is welcome to so many of our state's residents. Childcare centers aren't just a critical part of our state's economy, but they also provide critical social and emotional supports to so many young families. New Jersey's childcare centers are among the best in the nation, held to some of the most stringent standards of care. And while these new safety standards are above and beyond the usual high standards of care we already hold, I'm confident that this provider community is up to the challenge. I want to thank you all for your continued partnership as we strive to keep all New Jersey residents safe, healthy, and connected, and support a robust and safe network of childcare centers throughout New Jersey. And with that, I'd like to turn it over to my colleague, DHS Commissioner Carol Johnson.
Thank you so much, Christine. Thank you to Commissioner Byer and her colleagues at the Department of Children and Families. This really is an interagency process that works. Sometimes you hear all kinds of things about interagency government processes, but the partnership between our departments is really an effective one. I want to begin by thanking you, particularly centers that have opened for emergency childcare. We know it hasn't been easy. We know it has dramatically changed how your business operates, but we appreciate all the effort that has gone into ensuring that childcare is available for essential workers at this time. As Commissioner Byer mentioned, we will continue that program, continue those subsidies through June. It is also incredibly important to us, and we are so appreciative of the larger childcare community in New Jersey who has really continued to work hard throughout this pandemic to think about how we make sure that childcare remains robust, quality, and safe as we go forward. I know you've done a lot of work with our congressional delegation and with others to help ensure that we got resources like what we got in the CARES Act, and that will continue to be part of the dialogue in Washington about what recovery looks like, because we all know that childcare is essential both to children's development and to economic development. And at this moment in time, the two of those things are incredibly important. So just briefly, we in the Department of Human Services, those of you who know us, who participate in the subsidy program, our traditional childcare subsidy program and Grow NJ Kids know us through that avenue. We are able to work with families who have lower incomes to be able to ensure that they can access quality childcare. We work with we fund and support the childcare resource and referral agencies that are able to help families select the childcare centers of their choice. And so that is critical work that we will continue to do. We want to make sure that those slots and that and those resources are available to families as they come back to work. And so we will continue to pay childcare providers for the slots that were filled in March. So based on your enrollment in March, when centers first closed for children whose care is covered by our subsidy program, we are going to continue that this month. And then going forward, so we are going to continue to think through where there are ways for us to continue to help families in the future. As Christine mentioned, we have made available $20 million in grants. Those are $5,000 awards for each child care center, not just child care centers that receive our subsidy, but all child care centers, to be able to have access to resources to pay for things like PPE and cleaning supplies and the like. And in June, our subsidy program will continue to pay based on March enrollment, as I mentioned, not just your June attendance of your subsidy children. In July, our subsidy program will also continue to pay providers based on the center's March enrollment, which I hope is good news to you, but with two exceptions, just because we have to be able to manage the program under the appropriate rules. So to ensure that we're not paying twice for the same child, when we calculate the July payment, a center's March enrollment number will be adjusted downward if there's a child receiving subsidy in March in your center who's now receiving childcare in a different center in July. So if a child moves, we will have to move that subsidy payment to the center that they moved to. But if they're otherwise remain enrolled in your center, we will continue to pay them to pay you based on that child. And then in calculating the July payment, the March enrollment number will also subtract any child who's no longer eligible for the subsidy program, which is pretty much, situations like where a family moved out of state. So then we are also working towards a short-term subsidy increase. We don't have more to say about that today, but we will have more to say about that in the near future. We know that that the subsidy program is a critical part of the of ensuring the stability and the future of the childcare network for our families that we serve, and we want to make sure that we are able to continue to support your needs as this process moves forward. So we, like Christine, I want to thank you for the work that you have done and for your commitment to the children that we all serve, and for your support for the critical staff who are the individuals who make a difference in this work all the time. And so with that, I'm going to turn it over to Brian Ross, who is the Assistant Commissioner with the Department of Children and Families, who's going to talk a little bit about the details of the DCF guidance and the particular reopening guidance. And then Natasha Johnson from the Department of Human Services from our department will talk a little bit more about the grant dollars and some of our subsidy issues. And then we're happy to continue to work with you as in the days ahead as you look forward to reopening and as you consider what other issues and challenges you may be facing. And with that, I'll turn it to Brian. Thank you.
And thank you, Commissioner Johnson. I appreciate that. And hello, everybody. Welcome back. I know based on the numbers we heard when we first logged on, there's quite a few of you out there, and that means you're all excited to get back to business. And I think we're all extremely excited to see you back online too. So I'm, as Commissioner Johnson just indicated, going to run through the health and safety standards that we're going to be enforcing and sending out to you very shortly, and also some of the application process to sort of get you all back online and get those inspections underway. So to start with, everyone should at this point, and if not yet, sometime later today, the email servers have been working pretty much full time since yesterday to get some of these application and enrollment materials out to you, including that attestation form that both commissioners referred to, which is really our way of making sure that everyone has seen and read the health and safety standards that you're now going to be expected to abide by, and also to let us know that you do plan to reopen so that we can get the ball rolling and make sure we have inspectors scheduled to come out and see you. So everyone should have received that copy by email. If not already, then sometime today. If not, your inspectors will be reaching out to you, and I know you're all familiar with the inspectors who visited you previously. And if somehow we still haven't managed to reach you and you still don't have those forms, definitely let us know at that Ask DCF email address, and we'll make sure we get those things out to you right away. So as far as the health and safety standards go, they're really, just to not belabor the point and read the whole document, which again, you all should have at this point, really wanted to focus in on 5 really critical areas there, which would be the screening, the social distancing, the sanitation, some reporting, and then your virus response processes. So screening, first and foremost, because this is what's going to happen first thing every morning at your centers from here on out, at least for the duration of the current pandemic scare. We're expecting everyone who comes in or out of your center, whether that be children, staff members, or some very limited categories of visitors, including even our DCF inspectors, need to be taking a temperature. Anyone who has a temperature above 100.4 degrees Fahrenheit cannot be allowed into the center. Again, that includes emergency personnel, inspectors, anyone else who might be showing up to be admitted to the center needs to have no fever at that point. And you also need to ask questions about symptoms they may be exhibiting for COVID-19, which include coughing, shortness of breath, tightness of breathing. Very, very strict limitations on who can visit the center, even if they are screened. So we do not want outside adults, for the most part, coming in and out of the center. That includes, in a lot of cases, outside music instructors, entertainers, speakers, parents under most circumstances. Really want to make sure we keep that pool of adults who are coming in and out of centers very, very limited. And make sure that those who are, again, very, very limited pool allowed in, that you're double checking everybody. We do have 2 methods outlined in the health and safety guidance that you can be using. One relies on physical barriers, so that you're screening people through some manner of plastic shield, something like we've seen at gas stations and retail establishments as of late. The other is to just rely on social distancing and make sure that your folks are using their masks and standing far enough back. We've also heard some folks employing an automobile based that folks are driving up and they're testing through a car window. That's fine too. We do expect, if you're using a communal thermometer, something that the center is providing, that's sanitized between each usage, or else you're using the slip covers, the plastic covers. Definite preference for the forehead or the no-touch thermometer, or you can allow parents to bring their own and just check that through a glass window. Somebody does need to see the temperature. Social distancing, and this is going to be a fairly big change for a lot of folks. We need to make sure that we're keeping groups very small. We've got them limited in the child care guidance there to groups of fewer than 10 children. I'm sorry, 10 or fewer children. That number does not include staff, but we would expect that to be a fairly low number even with staff there. So if we're looking at 10 children, we're probably looking at no more than 2 staff attached to that. And we need to make sure that we're keeping 10 feet of distance between those groups at all times. To help facilitate that, DCF is intending to continue the waivers that we put in place in the regulations at the very beginning of the pandemic to eliminate some of your indoor and outdoor play space requirements. So we're hoping that the elimination of those play space requirements will free up a lot of your space to allow you to separate groups a little more liberally without having to reduce your overall numbers, so that any indoor play space and the indoor outdoor playground space can be relied on for actually keeping those groups separate to the best you can. We do want to be sure that that children are not migrating between groups, so there is very, very limited, if any, interaction between the groups, that staff are assigned to these groups, that they remain consistently with those groups, and that you don't have staff switching in and out between 2 different groups. We understand the situations will come up where substitutes may be necessary. It's very unlikely that your staff will work consistently without a sick day or without a vacation day at any point during this period, but we want to make sure that the staff is not moving between one group or the other, so that you have consistent substitutes for each group and that there isn't a lot of migration of germs between the various groups in your center. And then the big issue that I know is on a lot of folks' minds, and the commissioner did touch on that, masks. And we've heard a lot of questions about masks and whether kids are going to be required to wear those. The short answer is sort of. We are encouraging kids over 2 to wear masks at all times. I've said this every time we've had this discussion. I have a 3-year-old. I tried to put a mask on her. It stayed on for maybe a minute and a half. We understand it's difficult. We don't expect your teachers to be enforcing this, to be holding masks on, adjusting them, various things that would involve them touching kids' faces at all times, because obviously that is a much more dangerous situation. But we definitely want this to be a teaching moment, something that can be used to encourage the use of masks where it's possible, particularly as the children get older. Particularly as we approach school age, because we know in a lot of cases the schools may encourage or require or otherwise involve wearing of masks at certain times during the school day, and we want to make sure we're getting that lesson taught early and encouraged early. So to really emphasize that point, because I know there's been a lot of confusion, kids are not going to be required to wear masks, but we are definitely going to encourage kids to wear masks over age 2. And when our inspectors come out, we're going to be looking for some encouragement that there is some discussion of masks, so that you have masks available, that people are doing their best to encourage kids to wear those. Your staff, as opposed to the kids, we are going to be requiring staff to wear masks at all times, unless they have a medical condition that prohibits that. So again, staff, yes, wear masks. Kids, definitely encourage, would like to see it, but we understand that's going to be very difficult. Medical conditions, we would treat as any other medical condition. We will not necessarily be looking for the documentation, but we expect that there is some bona fide verification of that you are looking into it and asking whatever you need to do to accommodate that. And if it's a medical condition that cannot be accommodated in a safe way, that we, you look to make various accommodations within your employment practices. Further along the line here with social distancing, shared supplies. We want to make sure we're limiting the use of shared supplies, that when you have, for example, art and school supplies, pens, pencils, crayons, painting materials, toys, that those things are either being kept consistently with one group and not shared between groups, or that if they are shared between groups, that they are being sanitized and cleaned in between each usage. Ideally, we would be having limited sharing, keeping everything within one group. And we would also discourage the use of things that can't be cleaned easily. So plush toys, fabrics, things that would actually require quite a bit of time to sanitize in between usages, we would discourage because it really can't be done safely. Toys from home has come up quite a bit, and we do want to bring that up. We do allow in the health and safety guidance specifically that toys can be brought from home, but they need to be sent home at the end of the day to be washed, and then their usage needs to be limited to the child that brought them in. So we're very conscious of the environment we're dealing with here. So if a child needs to bring their teddy bear or whatever toy they need to bring with them to school each day, they can bring that with them. This is not prohibited, even if it is a plush toy. But we need to be very conscious that we're sending that home, not letting it be shared, not letting that be something that gets passed around the classroom. And then further down the sanitation front, moving on to our third topic, this is, we really get into the science of this here. We want to make sure that you, when in doubt, something needs sanitizing that is being sanitized, that you're encouraging frequent hand washing between any interaction with kids that might involve the spread of germs or the spread of the virus. This includes the obvious times that we believe you're already practicing, which mean after each use of the restroom, after each diaper changing, after visits outside, inside, anything that would involve touching a doorknob, any interaction with a child that involves touching their face, or any action that involves a staff member touching their face. We would encourage kids to be encouraged to do this just as often, and really emphasize those important hand washing practices. When you're looking into materials for your cleaning and sanitization, there are very, very specific directions included in the guidance that we have out there. You're really looking for alcohol-based cleaning solutions that are at least 60% alcohol, and things that also conform to the EPA's guidance, which is attached to the guidance that we sent out that deals with sanitizing materials that can be used for COVID-19. And I won't get into all the details because I know we've got a lot more important stuff, and Natasha's going to talk about the money, which I assume is going to be better news for everybody at the end of this, so I won't hold that up too much. So any questions on that, definitely let us know. On the reporting, and this is something that's going to be very familiar to those of you, the 500 or so that have been emergency centers for the last 2 months. We are really looking for a lot more daily information from each center out there for the next foreseeable period, where we're going to need to be hearing from you every day by 11 o'clock. There is an online form, which your inspectors are happy to go over with you. And if you have difficulty accessing an online form at your center, we can come up with alternative arrangements. Just let us know. But we're going to need to be hearing from everybody about your attendance, the numbers. We'll need certain information on the screening process. So we'll need the names of the kids and the temperature that you took, the number of kids who may have been turned away because they were symptomatic. And we'll also need to hear about any shortages you're experiencing of essential supplies, which mean your cleaning supplies, your hand sanitizer, your gloves, the various PPE. So that information should also be coming out to you pretty shortly if you don't already have it. Again, our email server is really working overtime to get that out to you. But we expect to hear from that every day, 11 o'clock. And we'll be following up on that if we don't hear from that. We did try to keep it as simple as possible. It really is a one-page sheet that can be filled out pretty quickly. We estimate it takes possibly 5 to 10 minutes. And then finally, and I think this is the easiest one for me to talk about because I'm mostly going to boot to the Department of Health. If and when you do have a situation in your center where you have COVID-19 exposure, where somebody is diagnosed, somebody is symptomatic, the big takeaway from this call, without getting into the details that health will share with you, is you need to make sure you notify your local Department of Health. And we also would like you to inform the Office of Licensing as soon as humanly possible, because we need to know that information so that we can take appropriate action, including with our colleagues at the Department of Human Services to find alternative care for those kids who they have some responsibility to do that for. We definitely want to know. This won't necessarily mean that the center will be closed down for any length of time. It really is a subjective determination by that Department of Health what needs to be done to make sure everybody is safe. But in order to address that, you need to make sure they're let know as soon as possible. And so just really quickly before I again hand over to Natasha, who has a lot more information on benefits and other things that I think y'all are much more excited to hear about. The inspection process that's going to be launching from when we reopen here on June 15th to approximately July 15th. We're really looking first and foremost at these safety standards. So we're definitely going to be looking at the screening processes, looking that you have the facilities in place, that the process is being adhered to, that things are working appropriately. We're still going to be looking at your staffing. We're still going to be looking at overcrowding. We have not changed the ratios, so your staff to child ratios remain in place. And we're expecting the process to be a lot quicker. We're really not getting into the same depth that we would normally get into, but we are going to be looking for those top level things to make sure everything is running safely. A lot less focus on curriculum and programmatic issues, but we're really, really going to zero in and be really scrutinizing hard the safety measures that need to be in place. So it will not be a typical inspection, but we do expect to have inspectors out there early, often, and frequently. So With that, again, any questions? I know we have the Ask DCF email address is there on the notes, and all of you should be in contact with your inspector. If not, please definitely reach out. We're excited to hear from you. And we will definitely be in touch many, many times in the next couple of days. So with that, because I can't actually see the questions on the way the Zoom is set up here, I'm going to hand it over to the Assistant Commissioner from the Department of Human Services, Division of Family Development, Natasha Johnson.
Thanks, Brian. So as part of our efforts to assist you in meeting the health and safety standards that Brian just described, the Department of Human Services is making health and safety grants available to all child care centers and summer camps. So this is regardless of whether you accept subsidy children or not. Centers will be able to apply for up to $5,000 and summer camps will be able to apply for up to $2,000. So just a little bit on how to apply for these grants. You can go to your account on the New Jersey Child Care Information System, which we call NJCCIS, which is the New Jersey Workforce Registry. Every licensed provider should have a user account on NJCCIS, but if you do not, you need to go to www.njccis.com to create an account. A document is posted on NJCCIS with screenshots that will walk you through how to apply. And also we'll have this document on our website, which is childcarenj.org. But the quick version of how you can get to the grant applications is that you go to the provider tab, select your providers, and then go to quick links. In that quick link section, you will be able to select health and safety grants. And then from there, you'll be able to go forward and complete the application. If you have questions while you're completing the application, there's a help button at the top of the NJCCIS homepage, or you can call 1-800-332-6512. And I'll repeat that number for you. You can call 1-800-332-6512. We are turning applications around in 2 weeks. We've had a lot of applications in the last week. But we are hopeful that we'll be able to maintain that time frame. A couple of notes on this: you can apply for the grant even if you've applied for health and safety grants before, because we know we had an open window earlier and then some for the emergency child care providers. No worries if you've already applied for those grants, you can go back on and apply for the grants in NJCCIS now. So just a couple other points I'd like to make, just clarify some of the things that Commissioner Beyer and Commissioner Johnson already mentioned. So Commissioner Beyer mentioned the ending of the emergency child care program at the end of June. Because June 30th is on a Tuesday, we're going to carry the payments through the end of the week, so it aligns with the pay period. So parents will be able to complete that week and not have to figure out how to pull their kids out on a Tuesday. We'll be able to keep them on Friday. And because the pay period for you on July 3rd, that we will pay you through the end of the pay period. So everything technically will end on July 3rd, even though the program ends June 30th. And I just want to reiterate a couple of things that Commissioner Johnson mentioned earlier on subsidy payments as we go forward. So as she said, we're going to pay the subsidy rate based on enrollment for the month of June. In July, we'll pay based on March enrollment with the 2 exceptions that she mentioned. So if a parent decides to go to another center, we have to pay the new center for that child. Or if the child is no longer eligible for the subsidy program, like they move or they age out, we will no longer pay for that child. But the part that I wanted to make sure to provide some clarity on is that we will be paying, if a parent decides they're not comfortable bringing their child back in July, but they're on your roster and enrolled in your program, we will be paying to hold their slot for the month of July. So you still will get paid for those children, even though they're not physically at the child care center. We will also, parents will also not have to pay for co-pays for June and July because we will be paying the full subsidy rate. So you don't have to worry about trying to collect co-pays from parents for June and July. Also during this period of time, I know people had lots of concerns about the e-childcare system and parent swiping. So we're not going to be requiring you to swipe in June and July. You will have to do an attendance log and submit that attendance log to your local CCNR. And we will have further information as time goes on about when we will go back to swiping and using our e-childcare system. But you will not have to do that for June and July. We're also looking to provide to you some additional supports through our quality initiatives. some of which include our childcare health consultants through the Central Jersey Family Health Consortium, social and emotional health resources through Montclair State University, and school age supports through NJSAC, which is the statewide network for New Jersey's after-school communities. This information will be posted in the provider section of our childcare website and on NJCCIS. You'll also be able to find links on our websites to the CCRNRs who can answer a number of questions for you and provide additional supports. And you also have a link to our Growing J Kids website from the childcarenj.gov. So over the next couple of weeks, we're going to be looking to make some health and safety trainings available to you on a number of topics, some of which include hand washing, when and how hand washing procedures. So sort of following up on some of the things that Brian mentioned earlier, sanitizing surfaces, a sanitizing video to walk you through things, diapering and changing, and self-care for early childhood professionals. So again, I just want to close by encouraging you to visit childcarenj.gov website to get information on these additional resources. We'll also have this video available later for you to come back to as a resource. And then definitely sending in any questions that you may have about payments, but just understanding that June and July, no co-pays, paying based on attendance, switching a little bit in July based on the kids that are not there because they're not eligible or because their parents have selected another center. So with that, I will send it back to Commissioner Byer.
Hi, thanks, Natasha. So I hope that we were able to provide you all with answers to many of the questions that you may have had as you logged in with us today. If not, and you have further questions or you want more clarification or specificity on some of the questions that, or the answers that we've provided, again, I'm going to encourage you to reach out to us via email. If you use the askdcf.dcf.nj.gov, we will make sure that someone gets back to you to answer your questions timely. And we will also be gathering those questions and the ones that are most frequently asked, we will look to put together into some kind of a format that we can then send back out to all of you. One final thing that I forgot to add talk about in my opening comments that I wanted to share with you now is that if any of your centers are private nonprofits, you are classified as a private nonprofit, you are eligible or may be eligible to receive assistance through FEMA and for any of the expenses related to operating within the COVID pandemic. Specifically, FEMA will reimburse private nonprofits for 75% of the expenses that were put out. And you can go to the New Jersey Office of Emergency Management website for that information. We also, I think, have a link to it on our DCF website, on our COVID-19 page. There are 2 webinars left that the New Jersey Office of Emergency Management are conducting specifically to walk private nonprofits through the application process. It's an online process. It's fairly simple, not a lot of information and not a lot of paperwork. The 2 webinars that are left are both on June 5th. One is at 11 a.m. and the other is at 3 p.m. And again, we can get you that information about how to access it, but certainly you can go to the New Jersey Office of Emergency Management and they can provide you with the details of how to log in. So with that being said, I really want to thank all of you for your participation today, for your interest and willingness to be able to open and provide services to children and their families during the pandemic. Finally, for your partnership and for loving and caring for New Jersey's children. Thank you all. Be well. and we look forward to working with you through this process. Have a good rest of the day.